reminded me of it when you're talking about, again, changes to the manual, and we're talking about, cutting back as it comes to staffing, deals with screening. So we brought some slides. I know I've got, if you'll skip the one that's that one and just go to the next one, okay? We'll just leave that one there for a minute. So the ACR used to have this screening form that came with the guidance document.
Right.
And it was like an appendix to a guidance document. And it was mediocre at best.
Yeah.
Okay. I never saw anybody use it. Right. Okay. It wasn't very detailed. This one is massively different.
So ACR has their own screening form.
And actually, yes, and it's outside of the document. And in fact, in the document, they say it's available online. Actually, and you can, again, easily find it on the website where the manual lives. If you look down through there it says screening form, and you can click on the screening form, and you'll get this.
And where once it was 2 pages, it is now, I believe, 6 or 7.
It's 6 pages.
Wow.
Okay?
But there's some really interesting portions that are now included. And one being almost an entire page that's about the technologist. Did you check for these, different things? Bill, you've got it right there in front of you.
Well, I've got it right here. Let me just kind of run through it. Okay, so the first 2 pages, so this is the first one. It's the general kind of stuff. And to the right, you'll see the second page. It's general clinical. This is typically general clinical history. It talks about injury by a metal object, injury to your eye, asthma, allergies, kidney disease, diabetes, clinical type stuff.
Right.
Okay? And then it says the following items may be harmful to you during MRI scan and may interfere. You must provide a yes or no for every item. And then it says, so a big heading here. And it says, indicate if you currently have or ever had any of the following. And it's got surgically implanted medical devices. So then it goes through the section here of the section of surgically medical devices. Okay, now we can go ahead to the next one. And this is the third page on the left side, and going through, again, medical devices. And then it's got a heading that says removable medical devices. So in other words, it's it's kind of separating them out in categories.
Specifying,
And, talking about artificial hearing aids, artificial eye. And most artificial eyes are.
Yeah, we have a discussion with that.
Radiologists, I don't know, but be that as it may, medication patch. So and then on the right side, goes on with some more of these, and then it has a personal heading. It says personal.
And let's get personal.
Well, it's pretty personal. Body piercings, wigs, hair implants, tattoos or tattooed liner, hair accessories, jewelry. It says metal containing clothing material and or underwear. Interesting. We'll talk about that.
Right.
If you want to.
Sounds like an interesting story.
Well, no, it's some interesting considerations because they going to the manual. They specifically mention that there's a section specifically on clothing and specifically mentioning underwear. Okay,
right.
and we'll talk about why maybe later if you want to.
For sure.
And then fitness tracker. Make sure you don't have your Fitbit on when you go in there. Okay, so we can go to the next one. And then this next one is just a single page, and it says instructions for patients. You will be provided hearing protection. You're strongly urged to use the earplugs or headphones. This is interesting to me. We personally are of the opinion that hearing protection is not optional.
It's mandatory, yeah.
It's mandatory.
Yeah.
Okay. You can't. I'm a handgun hobbyist. So I've got indoor gun range. I can't go and shoot if I don't wear hearing protection.
Right.
They won't let me.
I can't go to the airport. Well, I can and say, I don't want to go through that metal detector. They're going to be like, that's fine. You're not going to fly.
Yeah.
Right. So this shouldn't be. That's the one thing about this manual that kind of surprises me. It's like
surprises me too.
It should,
But then you just refer back to the FDA and the IEC, which and if you don't know what IEC, it's the International Electrotechnical Commission. They both say for A-weighted root mean square RMS systems that are capable of exceeding 99 decibels must provide appropriate hearing protection. And I'm not going to get into physics like he did earlier, but EPI diffusion falls around 110.
Right.
So, and then
we're reaching 130 sometimes, right?
Well, close. Could be close.
It could. Right. Now, painful acoustic trauma is at 140, and all clinical vendors are limited to that. So, but you have to provide. We recommend 25 to 30 decibels reduction, and so I don't like the way. No offense to the ACR. I don't like the way it's worded for hearing protection. But if you just go back to what the FDA guidelines are and what the IC says, then...
And what the equipment vendor tells you in its user manual and
yes.
its instructions for use.
Right.
You want to get yourself in trouble in a lawsuit? Don't follow the instructions for use that the vendor provided you.
Right.
Okay?
Right.
Why did you choose not to follow their instructions? Right. So again, I don't get the hearing thing. But they do say that if it's for every any research sequence not FDA approved, you must provide hearing protection. Okay, what about the others? I don't get it. Anyway, so it goes through the stuff for the patient to remove, okay, and then the patient to sign that I've read and understand our contents is formed. The next page is one of my favorites, okay? This is safety screening for MR procedures for MR office use only, okay? So this is for the techs or whoever's doing whatever level 2 person is doing the screening. That's a whole other subject. Who should screen, right? Okay.
Right.
But so you basically got to know what you're asking if you're screening somebody. This is not checking a box. This is an investigation. In fact, when I started MR in 1985, we referred to it as interviewing the patient. That's what we called it. We didn't say screen the patient. It was interview the patient because we sat down and we interviewed the patient.
Right.
Okay?
In an interview room, probably, too, right?
Yeah. Well, we had this private little dressing room where you could sit down, look at the patient, and talk to them. Right. Because if you've done an MR long enough, you can look at somebody and you go, you're not telling me the truth.
Right.
What?
Oh, you don't get that question, dude.
Right. Right. I just remember one guy on the screening form, because we would always ask, when was your last menstrual cycle, again, looking at pregnancy. And that was kind of a roundabout way of, might you be pregnant? It was kind of a double check for it. At any rate, this one guy wrote Yamaha. Who had last menstrual cycle, he wrote Yamaha. And I looked at it and I said, and I thought, was he being? And he wasn't. He was serious. And I said, Yamaha. What? He goes, yeah, I was wondering why you wanted to know what type of cycle I had. And I said, well, there's some Harley people here, and I'm just curious.
Okay, I'm just going to say this is mine and Bill's opinion. We have several opinions. I'm sure you can tell. Is that you should also verbally ask the patient, is there anything on you or in you that you were not born with?
And that's kind of part of that hard stop, the zone 4 that they've also was
the full stop final check.
Yeah. I think it should be asked earlier.
Well, we do. We do.
But
we also do that last.
But that's a really good question to ask somebody.
Because people will say, let's say they have an implanted device that's no longer functioning. They're not using it anymore. And I would think, why mention it? Because, I wouldn't think that. But most people think, why even mention that? Because it's not functioning in my body anymore. But asking them that verbally, they'll be like, I do have this pump that was used this. And then you got to know.
Right. We at our hospital, we do a lot of transplants. And sometimes they'll put temporary pacemakers in. Yeah. And sometimes they'll leave those leads in afterwards. And, people sometimes might forget because they don't have the pacemaker. Oh, it was taken out. And we'll check X-rays. Right. And almost every time they have leads.
Oh, yeah.
Yeah. Any time a pacemaker is a pacemaker that's going to have a lead in the heart. It's going to have not an epicardial, but one in the heart.
Right.
there's I was told there's like 10% mortality for explanting a lead because it's screwed down in the myocardium like with a little corkscrew, and you just don't jerk it out. Hold on, put your foot on it, pull it out. They just don't do that, so they're always going to leave it. So, to that point, if you look on this hazard checklist, it says, and see, this is for the MR personnel to be checking off. So, and this is like your full stop and final check. It says, do you have a pulse oximetry device, EKG pads, leads, endotracheal, Swan scans, extraventricular device, arterial lines reducer, Foley with a temperature sensor, which, people go, oh, they're okay. No, it's a wire,
right.
Anything that's metallic, if I didn't provide it and it's not part of the scan, it ain't going in.
Right.
Right. It's ridiculous. It doesn't serve any purpose. Rectal probes, esophageal probe, so on and so forth. This making, the tech. And if yes, explain it. And then it says, if any level 2 personnel checklist items are answered yes, this should be brought to the attention of the covering MR physician. And then there is a checkbox for yes or no for a patient screened with ferromagnetic detector.
Aha.
Okay.
I like that.
So let's say we don't have it. So these are all checked no. And then so something happens. It's obviously, I think if a site didn't feel necessary to use ferromagnetic detection, then they're probably, I'm going to guess that their screening is a little light on the light side as well.
Right.
Likely.
For sure.
Right. Just guessing. And then there's an EGFR indicator for contrast, and that would be dependent on the policies, of the MD. And then cleared by the technologist and the radiologist, assuming radiologist clearance is provided. I like the addition of this checklist.
Yeah.
Because I think now you've got a screening form that, it's got, is well organized. And I do like that last page, especially. Then going back to what you asked before, okay, so we're going to get anybody on and off the table every 20 minutes, right?
So turnaround time?
Right.
And the other thing, as far as the screening, one change in the ACR manual for pediatric, the older population of pediatric patients, one in level 2 should be done with the parents present, and then the other one should be done without the parents. And I'll tell you that's because a lot of kids will get a lot of, for example, piercings, things that
chance of pregnancy,
anything, and so just to make it, you create that rapport. That's a big change. I mean, that was not in the previous.
Right.
Another previous was not. It was unconscious patients was definitely in the guidance document that we had, but now it's much more clearly stated. And I have to zoom because I have 2 pairs of glasses here. Sorry, don't say a word. So it actually says if you can't get a reliable history now that you have to do, or you don't have a CT, you don't have MRs, you don't have recent X-rays, that now they're saying that plain film radiography should include the head and neck, chest, abdomen, pelvis, and upper arms and thighs. If there are obvious post-traumatic changes to the distal extremities, those regions should also undergo plain film radiography prior to MR exposure. Oh. I think that's pretty clear.
That's very clear.
That's like a full body
X-ray
right there if you don't have any information.
Right.